think that is going to ultimately be revolutionary.
Or warn your doctor about a reaction you might have to a drug before it's prescribed.
The opportunities here are simply enormous.
We're closer than you think.
This stuff's here.
Your genome and the future of medicine, tailored to fit you. But there's another side to personalized medicine that's equally important, and that's controlling adverse drug reactions.
Right now in this country, more than 125,000 people die each year in America's hospitals from adverse drug events. It's the 5th leading cause of death in America's hospitals.
The DNA is the master molecule that tells the body how to work. It's the set of master instructions. In the instruction set, there's these 4 letters, and it turns out for each one of us, there are about 3 billion of those, and they're strung together end to end. It turns out that 99% of the building blocks are all the same, and 1% of them are different. But it's that 1% differences that make us different human beings.
It's also why a medication may work in one person, but have no effect in another.
We have drugs for breast cancer, and yet 40,000 women die of breast cancer every year in the United States, and an equal number of men die of prostate cancer. If we go back to what I call the Neolithic era, when I was starting to do this kind of research, and we see the changes that have already occurred, it is mind-boggling. The way we've been used to doing things, seemingly forever, but at least for the past 50 years, is going to change, and it's going to change very rapidly.
We realized early on that this was a really important opportunity for Mayo to be able to offer to its patients. The ability to reduce side effects, to choose the right drug and deliver it at the right time. Dr. Wischenbaum is probably the person that is most responsible for starting this field in the entire world.
He is the founding father of pharmacogenomics, that particular area which we look at the genetic and the genetic contribution to drug response.
Respond to the drugs that doctors prescribe for you. When I was in medical school at the University of Kansas, if we saw a child with acute lymphoblastic leukemia of childhood, the #1 cancer of kids, tragically, that child would be dead in 1 year. There was really nothing we could do for them. Today, 90% of the children with leukemia of childhood are cured today by the use of drugs. Not radiation, not surgery, by the use of drugs.
Most people who receive Plavix as an antiplatelet therapy do well, but 20% of us do not metabolize the drug, and therefore it doesn't work. We'll start seeing that newborns get their whole genome sequenced, and that genome is stored and then used as needed.
We'll know the genotypes that is the DNA sequence variations for all of the genes that encode proteins that either metabolize drugs, transport drugs, or are targets for drugs, so that if a doctor writes a prescription for codeine in the future, which codeine is still a fine drug for some people, then immediately the electronic medical record will recognize that this patient we already know in the electronic medical record that this patient has multiple copies of CYP2D6, the gene that makes codeine into morphine, and will send an alert to the physician, your patient might be at risk. Do you want to use this drug? Do you want to select an alternative drug, or do you want to change the dose of the drug? It's going to be amazing, but it's going to be disruptive. And wonderfully so, because we need to prevent disease, not treat it.
Hello and welcome to Health Talk. I'm Rick Leventhal, sitting in for Dr. Manny. Personalized medicine used to be a thing of the future, but the future is here. Doctors are now using a new technique to prescribe more effective medicines for chronic pain. Joining me now is Dr. Anita Gupta. She's an anesthesiologist and pain specialist at Drexel University College of Medicine. Thanks so much for coming.
My pleasure.
So how does personalized genetic testing work in your practice?
So as you know, we're all made very differently genetically. And these differences that we have genetically actually influence how we respond to medications. So what I have is actually a test that may predict a patient's response to these medications. For example, one patient I give one medication, they may actually have a wonderful benefit, and then the same medication in a different patient, they may actually have a severe adverse event.
So what is the test? How does it work?
So essentially, an individual, if they need to have the test done and if they're an appropriate candidate for it, they're given a sample of their saliva. That saliva is sampled by a laboratory, and then a result is sent back to the physician who ordered the test. Essentially, I'm able to do this test on the first visit, prescribe them a medication once I receive the results, and really personalize their medication regimen, and oftentimes I get benefit, which is a challenge for most of my patients. And certainly that test that we do for them, they take that information to other providers, primary care specialists. They can use it to maybe help them with other conditions such as heart disease, cancer.
This is going to shock you. It will blow your mind.
Yeah.
The big message is the cost of doing a DNA profile has gone from several $100,000, being impossible, frankly, 10 years ago, to now being $1,000. For $1,000, if I know everything about your genome and I can begin to pick out exactly where your weaknesses are.
You can match a blood transfusion to a blood type. What if matching a cancer cure to our genetic code was just as easy, just as standard? And that's the promise of precision medicine, delivering the right treatments at the right time, every time, to the right person.
Your genome and the future of medicine, tailored to fit you.